Well, according to the American Addiction Centers in 2017, 19.7 million American adults battled a substance use disorder. Sadly, it's becoming more and more common across the country. But if you're one of these people, just know that you're not alone. If you're looking a way to turn your life around, there's a lot of people out there waiting to help you, including our next guest from Post-Acute Medical. We're joined today by Dr. Mark Yohe. Dr. Yohe, great to have you with us.
Thanks for having me.
So talk a little bit about your program here and how it works for people.
So at Post-Acute Medical, it's a rehab hospital for people who have physical conditions such as stroke, post-joint surgery, and basically it's to get people back to a functional state of life.
And so do they come and stay with you for a certain amount of time, or what's a typical stay there?
So our typical stay is probably 7 to 12 days, but it is dependent upon what condition the patient has. So it really is individualized per each patient.
Nice. And can you give us another idea of sort of who you work with specifically, and then how do patients get admitted to your place?
Sure, patients can get admitted from actually anywhere. The nice thing about post-acute medical is that they don't require a 3-night hospital stay, which they would require to go to a transitional care unit. So they can be admitted from home, they can be admitted from the emergency department, from a physician office, and they can be admitted directly from the hospital if they've been admitted to acute care. They can come from assisted living as well. So we have a lot of options for patients to get involved into post-acute medical. We offer physical therapy, occupational therapy, and speech therapy, and they will do an individualized program for each patient.
Boy, it looks like a beautiful place. So give us an idea, if I were to come stay with you for a little while, like what can I expect during my rehab program?
Your rehab program is going to be, again, individualized per each patient to meet the needs of what their functional deficits are. And we have individual rooms for each individual, especially in today's age with COVID. You want to have a private suite, and we offered that. And we have one-on-one physical, occupational, and speech therapy. So we have a great program. We have a physician daily rounding by my group, and we admit the patient, follow them through the whole entire stay, and discharge them.
So if someone says, wow, this place looks fantastic, which it does, do they just call you up and say, hey, I want to come and find out more information, or what's the process to get started with you?
Absolutely. They can call the hospital. We have an admissions department. We have screeners who will take your information down if you feel like you are in need of a rehab, inpatient rehab stay, and they will get the ball rolling. So if a clinic's office can do the same, and obviously at the hospital they have teams that are working with patients and will send information out to the hospital if they have a potential admission. So we work with everybody.
Dr. Yohe, I got about 60 seconds left, so I'll just give you the last word, and how can people get a hold of you?
They can call the hospital or and get in touch with everybody, the admitting team at the hospital, and they will get the ball rolling with the admission process. The screeners will come out and do an evaluation to determine if the patient would meet the needs for the hospital stay.
Good stuff. Dr. Yohe, thank you much for the time and the insight. We appreciate it.
Thank you much.
Have a great day, and stick around when we come back. We're talking fashion right after this.